Hi, I'm Brent Hunsberger. I'm the personal finance columnist at the Oregonian. And here with me today is Bob Earnest. He's with Multnomah County Aging and Disability Services. He's the Medicare Outreach Coordinator. And we're here to talk Medicare because starting October 15th, Medicare beneficiaries can change their plans during open enrollment season. And it's the only time of the year that they can do that. Why, Bob, is it so important that Medicare recipients review their plans, even if they're happy with their current one?
It's important to make sure, first of all, that their doctor is going to continue to participate in that plan. Secondly, to see if there are any premium increases or decreases and copay changes. On the drug plans, there may be formulary changes where they change a medication from a Tier 1 to a Tier 2, or they change the copays. So it's a good idea to look at the whole picture and see what's in store for me in the next year. And just review all the information that you're being mailed by that particular company.
So your provider may fall out of your plan? Is that what
Correct.
you're saying?
Correct. It's not often, but it does happen.
Okay.
That doctors' offices will opt not to participate in a plan, and typically they will send a letter to all of their customer base indicating that. So it shouldn't be a surprise.
And your prescription drugs may change either the price or the coverage in the plan?
Correct. They could add medications to the formulary. They may actually remove some from the formulary. One of the things we're seeing now is we're seeing some medications that have been traditionally Tier 1 are now going to be Tier 2. So there's going to be an increased cost for those medications.
So how does one start to go about reviewing their plan and comparing it to another one that's out there in the marketplace?
Well, first thing, if you're currently in a plan, the plan should be mailing you, if they haven't already, plan changes and information for 2015. And then you can look at what your current company is going to offer. You'll also probably be receiving a lot of mail from other companies, so trying to solicit your business. Review those. You can go onto the Medicare.gov website, and that has a drug plan comparison tool, and from that you can go into looking at different health plans that also offer drug coverage, and you can get a pretty good comparison. It's very objective, and you can compare up to 3 plans at a time. So you can sort of figure out what you currently have, where you may want to go, and then possibly a third option.
And by the way, we have a tutorial online about how to use that plan finder. You can look on it on OregonLive.com. Also, this week, on October 12th, we'll publish our annual guide to Medicare Advantage plans with drug coverage. So you can compare plans, at least in the Portland marketplace. Bob, there's a lot of things to think about here. It sounds like an intimidating process. Where can somebody go for help figuring all this out?
Well, first you could look on the Medicare.gov website. Secondly, you could look on the Oregon SHIBA website. We have a consumer guide on the Oregon SHIBA website that you can access. And you can also contact, if you live here in Multnomah County, you can contact the Multnomah County helpline at 503-988-3646. We have staff available to answer questions and also take enrollment event appointment times. Here in Multnomah County, we're going to have 9 different enrollment events at different library sites where you sit down with a trained volunteer one-on-one and go over your options, answer your questions, and if you want to change plans, we can usually facilitate that happening. And so when you leave the event, you may have entered with Company A and you're going to leave with Company B, and Company B would then be effective on January 1st. So it's sort of a comprehensive one-stop shop.
Mm-hmm. And there are trained volunteers all over the state that
Yes.
can help people with this?
Yes, right. There's a SHIBA component that works with every county in the state. Some counties don't have active SHIBA volunteers, and in that situation, those calls are routed to the central office in Salem, and they take care of them from there. One of the things that's coming up, and I'm seeing more and more activity about this, especially at the Mount Hood class that I do, is the Medigap birthday rule.
And what is the Medigap birthday rule?
The Medigap birthday rule, if you currently have a Medigap supplement to original Medicare on your birthday and 30 days after. You can switch from light coverage to light coverage. So you can go from company A to company B, and there may be sometimes even a couple of $100 a month difference in premium. Been really popular because people now have some consumer protection to get out of really high cost Medigap plans and do like coverage to like coverage for less money. And they can do that every year. And it's been a real windfall for a lot of people.
We also have a list of sites where you can go to have appointments for enrollment or get more information in the October 12th edition of the Oregonian, as well as online. You can look up those events there. Or you can look at OregonLive.com/finance for our guide on Medicare 2014-2015. Thanks, Bob.
You're very welcome. Thank you.